On March 11, 2020, the World Health Organization made an announcement.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold. COVID-19 can be characterized as a pandemic.
The coronavirus, or COVID-19 disease, had already overwhelmed China, South Korea, Iran, and Italy. And this was a warning to other countries where it was now spreading quickly.
In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
The spread of COVID-19 was no longer something that could be stopped.
Of this unfolding crisis covered this morning. First, let's go to Today Queensland reporter Jessica Millward in Brisbane. Jess, you have some breaking news on recommendations from the World Health Organization. Australia has recorded its biggest one-day spike in cases since the outbreak began. Almost 100 more people testing positive nationwide in 24 hours. But experts warn it's just the tip of the iceberg. The AFL in limbo. Players now forced to weigh in on whether round one goes ahead. This coming as Anzac Day services are axed across the country and schools are taking matters into their own hands, shutting down despite government advice. We have every angle of this unfolding crisis covered this morning. First, let's go to Today Queensland reporter Jessica Millward in Brisbane. Jess, you have some breaking news on recommendations from the World Health Organization.
More than 100 people took advantage of a special shopping session for seniors and people with disabilities at a Woolworths in Sydney's north this morning. For more, reporter Antoinette Collins joins us now from Neutral Bay. Well, how did it go?
Well, Lisa, as you just said, there is a queue outside the doors here at the Neutral Bay Woolworths from about 6:45 this morning as people gather to take advantage of this hour that's been set aside by the supermarket to allow seniors, pensioners and those with disabilities to access the supermarket aisles without the general crush. Now, obviously, this is in response to some of the panic buying that we've been seeing over recent weeks, where there have been empty shelves of toilet paper and paper towels and rice and pasta and some of those staple items that have been quite difficult to track down.
Hospitals are at their absolute limit, with hundreds more deaths reported daily and huge challenges in caring for those infected. This is the story of one small intensive care team in one hospital at the very heart of the country's coronavirus outbreak, in the town of Cremona, just south of Milan. And a warning, viewers may find our international editor Lindsay Hilsom's report distressing.
Think what it's like to be a doctor or nurse in the epicentre of the epicentre.
So I'm glad to see that you're practicing social distancing. That looks very nice. That's very good. I want to thank everybody for being here today. This morning I spoke with the leaders of the G7 nations, and they really had a good meeting. I think it was a very, very productive meeting. I also spoke with our nation's governors. And this afternoon, we're announcing new guidelines for every American to follow over the next 15 days as we combat the virus. Each and every one of us has a critical role to play in stopping the spread and transmission of the virus.
And this live 2020 to Europe, to Italy, because health officials in this country are studying what they're seeing there, what they're seeing in France. We heard that from Dr. Fauci earlier. In Italy, in fact, they have more doctors and more hospital beds per capita than what we have even right here in the U.S. So we'll drill down on that as well. And tonight, the Vatican now revealing a bishop who recently met with the Pope has now tested positive.
Last week, we asked everyone to stay at home if you had one of two key symptoms: a high temperature or a new and continuous cough. Today,
government advice steps up.
Now is the time for everyone to stop non-essential contact with others.
A plea from the World Health Organization.
We have a simple message for all countries: test, test, test.
武汉陆续出现了不明原因的肺炎病人，
与华南海鲜城有关联的报告尚未发现人传人现象。27例、
41例、
59例、
77例、444例。
自1月23号10时起，全市城市公交、地铁暂停运营。
Hey, what's up, guys? So look, this morning I got some test results back for coronavirus and it came back positive. Yeah, and it sucks.
Would you prefer a 14-day just sort of national shutdown to slow this down?
You know, I would prefer as much as we possibly could. I think we should really be overly aggressive and get criticized for overreacting.
Okay. Should more Americans be prepared to be hunkering down at their house?
I think Americans should be prepared that they're going to have to hunker down significantly more than we as a country are doing.
The top infectious diseases doctor in the country, Dr. Anthony Fauci, with that warning yesterday on Meet the Press. Good morning and welcome to Morning Joe. And we begin this morning where we will most likely begin for some time to come. The many fast-moving developments with the coronavirus changing public life as we know it. Here's where things stand right now. The U.S. is under a national state of emergency, and the CDC has now updated its guidance, urging against any gatherings of 50 people or more in the next 8 weeks.
As we said last week, our objective is to delay and flatten the peak of the epidemic by bringing forward the right measures at the right time so that we minimize suffering and save life. And everything we do is based scrupulously on the best scientific advice. Last week, we asked everyone to stay at home if you had one of two key symptoms: a high temperature or a new and continuous cough.
Medcram.com. Welcome to another MedCram COVID-19 update. You can see the numbers here. They are starting to exceed that of mainland China when we look globally. What I wanted to get to today is something that a lot of you have commented on, and that is the receptor for the SARS-CoV-2 virus that causes COVID-19, and that is the ACE2 receptor. The ACE2 receptor is how the virus gets into the cell. It's the doorway.
Iron Engineers, in this video we're going to talk about COVID-19, or the novel coronavirus that was discovered in 2019. I want you guys to know that this video that we're making today, all the information that we're going to be talking about is as of up to date as March 15, 2020. You guys to know that. In addition, this video is purely for educational purposes only. We're going to have a medical disclaimer pop up here. Let's go ahead and get started.
So I'm glad to see that you're practicing social distancing. That looks very nice. That's very good. I want to thank everybody for being here today. This morning I spoke with the leaders of the G7 nations, and they really had a good meeting. I think it was a very, very productive meeting. I also spoke with our nation's governors. And this afternoon we're announcing new guidelines for every American to follow over the next 15 days as we combat the virus. Each and every one of us has a critical role to play in stopping the spread and transmission of the virus. We did this today. This was done by a lot of very talented people.
Today, the United States has tested its very first coronavirus vaccine. It went to a volunteer that you see right here, 43-year-old Jennifer Haller, who is from Seattle. That's one of the hardest hit areas for this virus in the nation, Washington State, with over 840 cases. It's a fast-moving story, and she joins us right now, the very first coronavirus vaccine volunteer, Jennifer Haller, and back with us for a medical perspective, Anne Rimion, an epidemiologist at UCLA. Jennifer, thank you for what you're doing.
Global death toll from this pandemic is now over 7,500, and there are more than 190,000 cases. I'm going to bring you up to date on the situation in a number of countries over the next few minutes. These are some of the most recent pictures to come in. This is from Barcelona, where people have been out on their balconies playing instruments, sometimes alongside each other. You can see a young guy there playing the saxophone. This is inside a rest home in Japan, where people have been exercising indoors because they're not allowed to go outside. And remember, the virus is particularly deadly for elderly people. And remember, Japan has the most elderly population in the world, so particular care is being taken. These people are exercising outside on their rooftops in Rome, doing it in part in coordination with other neighbours across the way. You can see most of them still staying a little distance apart. Not so active in Venice, but these police are out on the streets to make sure quarantine regulations are being observed. Bear in mind, across Italy, people can only leave their homes if they have an urgent work reason or they need to get some food.